Hello everybody, welcome to my YouTube channel. Welcome to Health Matters. Yes, indeed, health does matter. Our health is very important. I know you'll be surprising because it's not my regular to put on uniforms and workload, but it's because I have something that I really need to share with you all guys. You all know I never waste time when it comes to your health. I want to make sure you're having the best information, guys, when it comes to your health. So that's why you see me putting on workloads. Okay, you know that is very important and it's very severe. So what are we talking about today? Today we're going to be talking about a very important and a case study in our way or day-to-day affairs. So my name is Stephanie Agbonkwa, but I'm popularly known as Daughter of Zion. As you all know, Daughter of Zion is my name. So why am I here, guys? I'm here to educate you, to tell you about something that you shouldn't neglect. We shouldn't do this. If you see me stressing out on this, know that this is very important. So what are we talking about? We're talking about anemia. Anemia. Oh my goodness. Yes, we're talking about anemia. What is anemia? So we're going to talk about anemia. We're going to define what anemia is, and then we're going to talk about the signs and symptoms, some of the causes of anemia, and then also we're going to be talking about treatment of anemia. So that's why we are here, guys. So watch this video till the very end. What is anemia? Anemia is a layman word. Is going to tell you lack of blood. Yes, anemia is a condition where you lack healthy red blood cells. So that is what anemia is all about. Anemia, like I said, in the layman's word, is a lack of blood. What is anemia? Anemia is a condition in which your body lacks healthy red blood cells or a dysfunctional red blood cells, which lead to less oxygen flow to the organs or parts of your body. So anemia means lack of blood, especially the red blood cells. So anemia is a condition in which your body lacks healthy red blood cells or your body has a dysfunctional red blood cells, which as a result from low oxygen into other parts of your body or body tissue. So that is what anemia is. Anemia is a condition where you have lack of blood, especially lack of red blood cells to supply oxygen to other parts or other tissues of your body. So that is what is called anemia. So like we were saying, anemia is lack of blood. It is a condition where you don't have enough healthy red blood cells, and that will lead you to a reduction or destruction in your oxygen level or distributing oxygen to the rest of your body. So anemia simply means lack of blood, especially the red blood cells. This will lead you to a reduction of your oxygen to other parts of your body. So anemia leads to low blood cells, of course, low oxygen to other regions of your body. So why or what causes you to have a lack of blood? First of all, the number one cause of anemia, also known as lack of blood, is massive loss of blood. When you lose blood massively, you become anemic. Also, we also have lack of red blood cells production. The first point that I give as causes of anemia, lack of blood, is excessive loss of blood. Yes, excessive loss of blood is going to make you anemic, which means you don't have enough red blood cells to distribute it to other parts or regions of your body. And so does your oxygen too. So your oxygen becomes now low. So causes of anemia, we have loss of blood, we have low level of red blood cells production, and we also have high level of red blood cells destruction. So the first cause of anemia is loss of blood. Excessive loss of blood is going to make you anemic. Also, we also have low level of red blood cells production in your body. Another cause is high level of red blood cells destruction. So those are, we also have other causes of signs that include anemic or other signs or causes of anemic, which I'm going to point out. Other conditions that may lead to anemia include, we have heavy blood flow or heavy menstruation, when you know doing your menstrual flow, you realize that you have a heavy bleeding. So heavy bleeding, heavy menstrual flow. We also have sickle cell. Yes, guys, sickle cell. We also have, low blood destruction or high blood destruction. We also have high blood, when you menstruating and you are sending out a lot of blood out there, your menstrual flow is so super heavy. It's gonna lead you to anemia or anemic. You're gonna be anemic, which means you lost a lot of blood. We also have causes of anemia. We also have iron deficiency anemia. We also have sickle cell inflammatory anemia. We also have inflammatory anemia. So please, you want to watch out for these. We also have anemia's association with bone marrow disease as causes of anemia. Anemia's association of bone marrow disease. Another causes of anemia, we also have sickle cell anemia. We also have anemia inflammatory. We also have vitamin deficiency anemia. We also have iron deficiency anemia. We have sickle cell anemia. We have causes of, I'm still talking about the causes of anemia. We also have high destruction of red blood cells, and we also have low production of red blood cells, pardon. All of these are all signs, causes of anemia. Causes of anemia, you have anemia's association of Marrow's disease. We have iron deficiency anemia. These are all causes of anemia. We have vitamin deficiency anemia. We also have sickle cell anemia. What about anemia inflammatory? So these are all causes of anemia, and the most important causes of anemia is low blood production. Low red blood production is gonna cause you to be anemic, and also high level of blood destruction is gonna cause you to be anemic. The most important two causes of anemia, which is lack of blood, is low production of red blood cells is gonna cause you anemic. When the production of your red blood cells is very low or little, it's gonna cause you to be anemic. And also high destruction of red blood cells is gonna cause you to be anemic. So we don't want the destruction to be high, and we also don't want the production to be low. So the main two causes, all the other ones are still causes, but the most ones that work in due time, like it's gonna run down your blood real fast and you're gonna lack a lot of blood, is low red blood production and also high red blood destruction. Those are the most two causes. I'm not saying the others are not important, but these two are the most causes of anemia, for you to lack blood or lose a lot of blood. We have heavy menstrual flow. We have sickle cell anemia. We also have inflammatory anemia. We also have inflammatory anemia. We also have anemia's association of marrow disease. So these are vitamin anemia, iron deficiency anemia. There are a lot of them. So please make sure that you eating food, making sure that your red blood cells production is very high. So talking about now, let's talk about some of the signs and symptoms of anemia. Now let's talk about some of the signs and symptoms of anemia. We have first the signs and symptoms of anemia. We have dizziness, we have fatigue, we have extreme cold hands. You want to, sometimes I touch patient in the hospital, and then another way to tell that they are anemic or they have anemia is that their hands are extremely cold or their feet are extremely cold. I'm not saying that because your hands or your feet are extremely cold it means you're anemic. I didn't say that you have to, those are some of the signs. It doesn't mean because you have these signs you are definitely anemic. It doesn't mean that way. It is important for you to go check out that from your doctor. So signs and symptoms of anemia, we have dizziness, we have extremely cold hands or feet. We also have fatigue as also signs and symptoms of anemia. We have another signs and symptoms of anemia. We have your heartbeat become faster, fast heartbeat, And also we have skin pale. You become pale, and sometimes you're, I'm not saying that this is like in rare cases, because sometimes anemic patient, when you open your eyes and it's literally pale and really white, pale and like really white. Like, I'm not saying that whenever you have your eyes are white, it definitely means you're anemic, but these are some of the common signs and symptoms that we see with patients in the hospital. So their eyes, when you pull down the lid like this, their eyes is usually too white and pale. I'm not saying that, everybody who has white eyes or, their pale is definitely suffering from anemia. I'm not saying so, but in most cases, when you put down the lid of the eyes like this, it becomes pale and extremely white. So those are some of the signs of an anemic patient. And sometimes too, another signs and symptoms is that sometimes too it becomes pale. Their eyes become extremely pale, and then their eyes become pale. Their skin color becomes yellowish and really, really pale in such a way that another sign and symptoms of anemia is a shortness of breath. You always have shortness of breath, body weakness. You also have headaches, and you also have your skin color becomes pale and yellowish. Those are all signs and symptoms of anemia. So you want to watch out for that too. We also have palpitations, irregular heartbeats, chest pain, back pain, difficulties breathing. You also have your skin becomes too pale and yellowish, like I said. And also, you also have palpitations. We also have irregular, chest pain, irregular back pain, your nerves, those are some of the signs and symptoms of anemia. So please, you want to watch out for that. You want to really watch out for that. Like I said, take good care of your body. So now let's talk about the treatment of anemia. Let's talk about some of the treatment of anemia. I know this is a good part, huh? Talking about treatment of anemia. So the treatment of anemia is going to depend on the type of anemia that you have. For example, we also have blood transfusion as treatment of anemia, because anemia means lack of blood. It means your body is lacking blood, especially the white blood cells. So treatment of anemia, we have blood transfusion. And also, talking about the treatment of anemia, it depends on the type of anemia that you are going through or you've been diagnosed of. For example, let's talk about iron deficiency anemia. When you have iron deficiency anemia, then you want to take iron, you want to contain food that is high in iron, you want to contain medications, iron medications. So, treatment of anemia basically depend on the type of anemia. And the number one treatment we have is blood transfusion, because anemia is lack of blood. So treatment of anemia is blood transfusion. And also, going further, I said the type or the treatment of anemia will depend on the type of anemia that you were diagnosed of. For example, if you were diagnosed of iron deficiency anemia, of course you want to take or eat food that are high in iron, or you want to take medications, iron medications too. Also, we also have medication to induce blood formation in your body. We also have blood can be transferred to you if you lack blood. We also have medication that you can take to induce blood formation. What do I mean by induce blood formation? In order to, encourage blood formation of blood in your body, we also have medication you can take for that, depending on the type of anemia you were diagnosed of. It is important at this time for you to consume vitamins, vitamin C. It is very, very important for you to consume vitamins, a lot of vitamins at this time, especially vitamin C. It is important if you are anemic to consume iron, because iron is going to help you to produce hemoglobin. Hemoglobin is good because it produces red blood cells which carries oxygen into other parts of your body. So iron is important because it's going to produce hemoglobin. Hemoglobin is going to help you to produce a lot of red blood cells, and when this hemoglobin helps you to produce these red blood cells, it's going to help to transfer oxygen through the red blood cells production to other parts and regions of your body. So please, if you are anemic, it is important for you to consume uh, medications, iron medications, or food that are rich in iron, because it's going to help you to produce hemoglobin, and hemoglobin is going to help you to produce more of red blood cells, which is what we want. It's going to help you to produce more of red blood cells, and of course it's going to help you to carry oxygen to other parts of your body. So this, I think this is all what I have for you guys today. I've talked about the definition, causes, signs and symptoms, and now we ended with the treatment. The treatment, like I said, blood transfusion can be done. If you lack blood can be transferred to you. Also, another type of treatment is iron. Iron produces hemoglobin, where this hemoglobin can, it's a good production of red blood cells in your body, which is going to help you to transfer oxygen and the rest of red blood cells to other parts or other tissue of your body. So pretty much that's all what I have. If you have any question, you might leave it in the comment section below. Please like, comment, share the video as to many people as you can. Yeah, if you have any concern, leave it in the comment section below. Thank you guys for watching. I will see you guys in the next video. Bye.